I think we mirror Sri Lankan Airlines because we are part of Sri Lankan Airlines. But as a catering outfit, we had to make sure that we strive to be the best caterer in this part of the world. And we have won many great awards, Mercury Awards for the best caterer. We have won best caterer award from Etihad Airways, for Asia, Middle East and Africa. We have covered a lot of the world, and we have been adjudged without being given notice. They have come and done a impromptu judging, and they have awarded us that award. So doing so, I think we are always gunning to be the best and always beat our previous record. So it's the core value is to give the best food, the best Sri Lankan hospitality, the best Sri Lankan customer service, because end of the day we are in touch with those airlines and they have the benefit and the facilities to back cater, but they come to us because we give them value for money, and also we give them fantastic fresh product coming out of our kitchen. We are one of the very rare kitchens in the world which produces 99% of the product in-house. Whether it is bread, whether it is pastries, whether it is your salads, your salad dressings, everything is prepared in-house. But if you take Europe, most of the flight kitchens are, they are kitchens which only put together a meal. All the meals are coming outsourced. Your salad is coming from a supplier, your dressings are from another one, your bakery products are from, so whereas here we are still doing it and we are giving a very, very fresh, innovative product. So that itself is a driver.
Thank you, Mr. Fernando. So there you have it, folks. That was the special interview with Mr. Sarath Fernando. This is Dush Ratnaka signing off.
Hello everyone, welcome back to Good Morning Sri Lanka. I'm of course taking over from Dush, who was with you just now, and he is the host of a brand new program that we have here on MTV Sports, and that is of course Dine and Unwind. So if you want to learn the art of fine dining, it's a show that you would definitely have to look out for, and Dush Ratnaka is the host of that particular show, and he was with you earlier in the first segment with a very special guest as well. I hope you enjoyed that. But right now, going from one of our primary senses to another, we're going from taste to vision. And now vision is something that's extremely important for all of us, and I think that until you really get a problem with your vision or it's compromised, you don't really worry about it too much. But there are many ailments that can affect your eyes, and it's very important to take care of yourself and take care of your eyes. And when it comes to the different ailments that are very common when it comes to the eye, we have to speak about cataracts. Now cataracts are something that affects many people, especially the older you get, it can affect you even more. And to give us a sort of overview of this particular ailment as well as the symptoms and the causes, we have with us consultant eye surgeon Dr. Rangika Gunaratna.
Good morning.
Good morning, doctor. It's lovely to have you on the show this morning. So you're here to speak about, like I mentioned, now eye problems. I think people don't usually think about their eyes until something goes wrong with the vision. So when we speak about cataract, it's a very common sort of ailment, isn't it, doctor?
Yes, when you look at patients who are coming to us, the cataract is one of the commonest reason most of the elderly people come to us with vision problems.
Okay.
So if you look at the whole country as such, there are about 80,000 people who undergo cataract removals every year. So there's quite a big problem all over.
Yes, and there are with some new techniques as well that you're going to mention when it comes to cataract surgery. But before we go into that, I think we need to give an overall picture of what exactly is a cataract.
Yes, that's very important, because most people coming to us don't understand when we tell you have got a cataract. So to tell what is a cataract, we should understand something about the structure of our eye. So I have a model here in front of me, which I'm trying to explain what is our structure of the eye is.
Okay.
If you look at this model, we have the front of our eye. The front, the glassy appearance, what you see is the area known as the cornea. Then around that, the white of the eye is known as the sclera. It is covered with a layer called conjunctiva. So those are the front of the eye that we see when you open our eyelids. Behind this cornea, there was the glassy structure. We have a chamber filled with fluid. Through that, light goes, and then you have a central hole in our eye, right, which is known as a pupil. So through this pupil, the light goes, and once the light goes to the pupil, if you look at the inside of our eye, if this is the structure of the inside of the eye, light coming through the cornea to the pupil goes to a structure known as the lens,
Okay.
which is like a lens in a camera. So once the light goes through this lens, light goes to the back of our eye. From there, it goes to the optic nerve, or the nerve which transmits light to the brain. So when a light hits our eye, it should go through the cornea, the glassy structure, then it should go through the pupil, the center,
Okay.
and then it goes to the lens, and then it goes to the back of our eye. From there, it goes to the brain. So for this thing to happen, all these structures has to be healthy. So if there are a problem in the surface, if there's a problem in the lens, if there's a problem in the retina, then we will not see clearly. The cataract is a problem in the lens. If you look at the lens, if you take it out, it's something like a glass. It's just like a plain lens glass. So the light goes through this, and also the lens has the ability to focus the light to one single point.
So it kind of is like the lens you get in a camera, isn't it?
Yes, the same principle appears.
Okay.
So like the camera aperture, the light goes to the pupil, and then it goes to the lens, and the light gets focused. So when we lose that ability for light to go through this lens, or the ability to focus the light into the back of our eye, then we call that our vision goes down. So that the change in the lens, or the opacity of this lens, is called a cataract. If you look at a different lens, I will show another lens which has a cataract.
Okay.
So the appearance of that is this. If you look at these two lenses, one is clear, one is not clear. So not clear lens is called a cataract. So that is the basic understanding of a cataract.
Okay. And you mentioned earlier that this affects people who are mostly elderly. As
Yes.
you grow older, there's a higher chance of cataracts to develop.
If you look at the causes of cataract, now cataract is the opacity of the lens. So we know when we have opacity, we call this as a cataract. It can be, the cataract can be graded from a very mild cataract to a very severe cataract.
Okay, okay.
Also, we should know who are the people who are prone to develop cataract, and what are the causes of the cataract. So if you look at the causes, what we see, the commonest reason is our age. As we grow older and older, the risk of cataract become more and more. Usually we see cataract appearing after 50-55 years, but somebody who's 70 will have a higher risk of developing a cataract. And also people with diabetes has a higher risk of developing cataracts. So those are the two commonest reasons, but there are so many other causes of cataracts also, like UV exposure, the heat exposure, the injuries that happens to our eye, then certain drugs, medications, especially drugs like prednisolone, which is used for sometime our wheezing problems, sometime arthritis problems, sometimes the kidney problems. We use a drug called prednisolone. So those things can also cause cataracts.
And could it also be hereditary?
Yes, there are types of hereditary cataract also in the young age groups.
Oh, I see.
Right. So that's not very common, but mainly what we see was all the senile cataracts, or the cataracts we develop with age. They are the commonest causes.
Okay, so many causes actually that can lead to cataract. So I guess that's why it's pretty common.
Yeah.
It can come in so many different ways. But how do you detect a cataract? I mean, what are the symptoms that you should look out for?
That is quite important, because we see a lot of patients coming to us, they have not noticed that they have a cataract.
Okay.
So other important thing is that when people have eye problems, when they go to check their glasses, if they go to a doctor who is qualified to look at the eye, that person might be able to look at the eye and tell there's a cataract. But before that happens, there are certain changes that can happen to our eye when we develop cataracts.
Okay.
The earliest that we see people who drive at night, you can have a glare. When headlights comes towards you, you will see a glare coming to your eye. So that could be an early symptom of cataract. Then as cataract develops, the colors become little less clear and the images become less clear. If you look at something far, you will not be able to see. So if you have glare, if you have reduction of vision, if the colors are getting shaded, then you might be having cataract. Also, people should close one eye and check far whether they can see as same from the other eye also. Sometimes when you have cataract in one eye, if there's no cataract in the other eye, people will not notice the problem with the sight. So once they have these symptoms, they should get their eyes checked.
Okay, so
but also,
I think we have to go for a short break now, doctor. But we will speak more about how they can proceed once they do realize that the cataract is present and what the medical procedures are. So stay with us on Good Morning Sri Lanka. We'll be right back.